Today, I would like to introduce Dr. Hector de los Santos. He is a clinical psychologist here at the Mental Health Collective. He is one of our trusted trauma specialists here. And today, he's going to talk to us about how he thinks about trauma, how he treats trauma, and what's inspired him in his own studies and expertise about trauma. At the collective, he runs a number of groups, but the trauma-specific groups that he runs involve exposure therapies as well as cognitive processing therapy, which he is certified in through the Veterans Health Administration earlier in his career. Welcome, Dr. de los Santos.
Thank you. I appreciate it.
So we're going to ask you 3 questions today. The first one is, how do you define trauma?
Yeah, so I think with how I define trauma, there's, sort of the DSM-5 way of defining trauma, which is these are experiences that we either experience ourselves or we witness or vicariously experience, where we either experience sort of threat of danger or threat of death, threat of serious injury, threat of sexual violence, or maybe have repeated exposure to sort of grotesque images or something like that. That's sort of what we call criterion A trauma, or like the first piece of PTSD. But I think more colloquially, if we're thinking about trauma, I really think about trauma as something that we experience that defies our ability to conceptualize it, our ability to explain it. So our previous experience, the things that we've learned throughout our life have in some way not prepared us to be able to understand or grapple with the experience that we're having. And then when we have those experiences, those things are trauma.
So it's the DSM, which we all need to lean into as it defines trauma for the diagnosis of PTSD. But you also see trauma as being something that maybe doesn't quite meet criteria for PTSD, but can still be traumatic to a human.
Yeah, I think there are things that I think there are things that we experience that maybe might not fit those categories, but may go beyond what we feel like we have capacity for understanding, or maybe a repeated set of experiences that doesn't fit the way that we understand our world or the way that we sort of make sense of the world. And those things may then have sort of long-standing impacts on how we think about ourselves, how we view others, and what our emotions feel like in different situations.
With that in mind, I know that you really bring your expertise to the collective through both the practice of exposing people to things that they avoid, which we know is part of trauma, and helping people rethink through their stuck points and different cognitive appraisals they've made to help ultimately keep themselves safe, right? And make sense of the world after a trauma. Can you tell us more about that, how you treat trauma and how you conceptualize that?
Definitely. So I think in terms of how I think about trauma, when we experience trauma, it kind of defies how we make sense of the world. And we, from those traumas, begin to make meaning out of that trauma. How do I now see myself? How do I see the things that go on around us? And part of what tends to happen out of that, one is sort of cognitively, or in terms of the kinds of thoughts that we have, things shift. But then 2, experientially, what we feel in different situations, what we feel when we're maybe out of control, what we feel like when we're around people that are new, what we feel like when we're around a lot of people. Our bodies start responding in different ways than they maybe did in the past. And so in trying to treat trauma, if we look at it from the exposure perspective, it's really about addressing our avoidance. It's really about addressing really being able to address and process some of the emotional experiences that we had during and right following the trauma that we maybe have not had the opportunity to do because life goes quickly. Maybe we don't have the resources. Maybe we don't have the social support, whatever it might be. Because of that, we're not really able to process that emotion. And so we find ways to work ourselves around it. We find ways to keep ourselves busy. For some people, it's drinking. For some people, it's a variety of other vices. We find other ways to avoid it. So exposure therapy is about instead of avoiding it, instead of maybe running away from the emotion related to the trauma, we actually start to approach it. We start to expose ourselves to it. We start to begin to experience it. And we can do that in a couple of ways. We can do that by putting ourselves in some of the situations that bring up our emotion, allowing us to be able to experience that emotion and notice that that emotion may rise, peak, and then fall. And we can also do it through what are called imaginal exposures, or exposures where we try to remember back to the experience, traumatic experience we had, and sort of replay it in a safe space, in a safe context with the therapist. In doing that, sort of magically, we begin to become a bit more comfortable with different situations, places, and things. And we start to notice that the emotion tied to the trauma begins to reduce. And what times happen as well is that we start to make meaning, and maybe different meaning, out of the experiences that we had. So that's what exposure therapy looks like. That's how that sort of gets at accessing that emotion. You mentioned this. Do you want me to keep going?
Well, I was just going to say, I think you
Yeah.
explained that really well.
Yeah.
And what's the power of the group that you run with exposure? How do you see that playing out? Because so often exposure therapy is done in a dyad, right? And individual therapy. I'm curious about how that, that is unique to what we do at the collective, and how you see that being supportive together.
Yeah, I mean, I think often when we are struggling with trauma or we're struggling with avoiding things, we kind of think that we're the only person that is having that experience. I think groups are wonderful for um, sort of recognizing that other people can relate, maybe not specifically the trauma that we have, but to the emotions that we're experiencing and the kinds of discomfort that we might feel in certain situations. So I think group setting is really helpful for that. It's really helpful because people within our group can encourage each other with exposures. They can, in some ways, be part of different exposures, whether it's, hey, I'll go with you, or hey, I'll remind you, or hey, I'll ask you about this. Or with the way that we sort of approach prolonged exposure, with the way that we approach exposure, we're trying to think about how can we, in a way, have systematic desensitization. So build up over time. If you're afraid of crowds, we're not going to throw you into Disneyland. How can we maybe go to a grocery store? And so trying to take what are these bigger fears and how can we break them down into pieces so that we can expose ourselves and build confidence. And the group is wonderful in that way because they're really creative and sort of helping each other figure out, well, how can we maybe chunk this in ways that might allow us to step into the discomfort of being out of control, or step into the discomfort of taking responsibility. So I think that's sort of a sweet part of what our group looks like.
Yeah, I think you do a nice job of fostering that support too in our
Thank you.
groups.
Thank you.
Okay,
I appreciate it.
thank you. I interrupted you with that question, so keep
It's
going.
okay. It's okay. So I was gonna move to cognitive processing therapy. And so cognitive processing therapy takes a different approach than exposure. Exposure is very behaviorally oriented. The idea is that to some extent our bodies would go forward first and then our minds might follow. Cognitive processing therapy sort of flips that. It says, how can we have our minds go first and then our bodies follow? So with cognitive processing therapy, after we experience a trauma, it kind of blows up the way in which we think about things. It really impacts and has a cascading impact on the way in which we appraise ourselves, the world, and others. So cognitive processing therapy is all about how can we, again, in a way, address the emotion that's tied to our trauma, but how can we recognize the ways in which we have created our reality after this trauma? And what are the beliefs that we've created that has sort of made that reality? Those beliefs we'll call stuck points. That's sort of the big term within cognitive processing therapy. And so what we do is, can we notice and recognize these beliefs? Can we notice how they may be keeping us stuck in this pattern of PTSD, stuck in this pattern of avoiding, in this pattern of experiencing really strong emotional reactions in certain situations? And then can we, as we recognize those things, begin to consider if they're fully based on all of our experience, if they're only based on the one really damaging experience that we had. And so, where the processing happens and where we begin to touch on emotion is when we recognize a stuck point and we say, is this completely true? Are there different things that we've been missing? Are there aspects of our lives or aspects of experiences that we've had that we just haven't been including when we've been having these thoughts? And just doing that for most of our clients initially is going to be somewhat uncomfortable because we're opening ourselves up maybe in a way to considering something that we've been trying to push away. And opening ourselves up in that way is going to bring up some emotion for us. And so the process of cognitive processing therapy is that we recognize these thoughts, we begin to open them up to maybe different evidence or context we haven't considered. And then through being able to address these stuck points, maybe be able to create a reality that fits the facts better and that's more helpful for us and that takes away some of the emotion and some of the pain from the trauma that we experienced and takes away to some extent some of the takes away some of the power that the trauma may have over us and over the kinds of emotions and decisions that we make.
I often say to clients that trauma often happens in the context of a relationship. And so we heal trauma in the context of a relationship. And that's so often in that therapeutic dyad. But just like exposure, you do CPT in group here. And so I want to ask you the same question. How do you find the group setting unique and important for the trauma healing?
Yeah, I mean, I've had really wonderful experiences doing CPT in groups, predominantly with groups that get to know each other or have some relationship with each other. Because some of what's happening in that group is that people are not just being vulnerable with me for the first time, they're being vulnerable with a few other people. And in that group, what so often happens is that other group members are so empathetic and so validating um, and get to, even in a small way, shift some of the perceptions that our clients have about being vulnerable, that being vulnerable is dangerous, that people will take advantage of it. Well, here I am in this group of 8 people, 6 people that didn't do that. They, in fact, sort of embraced me. And so I think there's something beautiful in that. And a lot of the ways in which we sort of challenge our stuck points is by trying to take on different perspectives. And sometimes when it's just us on our own, it can be kind of hard to see sort of outside of our own perspective. In a group, we have multiple people that can jump in and say, well, have you thought about it from this angle? Or what about this? Or do you have experiences that look like this? That again, sort of broaden our clients or broaden our clients' perspectives to maybe consider context that they have spent a long time intentionally trying to ignore. Or maybe not so intentionally, but inadvertently ignoring or inadvertently not being or being naive to. So yeah, I think it's really cool to see at the end of sort of going through a group cycle of CPT how people are just so proud of each other and so encouraged by each other by having seen the work that they've done, but also the work that each other has done.
I think that really speaks to our clientele in the community we try to really bridge, especially in the trauma track of our treatment, that it's a
Yeah,
very small cohort, groups averaging, what would you say in your experience?
4 to 6.
hmm
Yeah,
Very small. They get
yeah,
to know each other, and that intimacy and vulnerability comes with that trust. So
mhm,
it's a big deal.
yeah.
So our final question really comes out of, for those people who are watching this and are inspired by what you're saying and want to be just like you, what kind of theories and authors inspire you and your work and how you've come to this place?
I first caution anyone that wants to try and be like me. I don't know that that's a good goal, but I think I mean the theories that sort of um, inspired prolonged exposure, inspired cognitive processing therapy, in a lot of senses made sense to me. So the way in which um, like we as humans tend to um, use our thoughts to understand and organize our world, or use language to understand and organize our world. That to me makes I can relate to that. I can relate to um, in part because of my experience as someone who has parents that speak a different language and are from a different place, and then also growing up in the States, I can see how language, or to some extent culture, shifts the way in which they look at certain things or understand certain things. And so the idea that our thoughts might have a great influence on our what we feel and what we do, and how we look at certain situations, felt like a lot of what growing up looked like for me, or a lot of sort of understanding being bicultural looked like for me. So then thinking about it in this context, it sort of again fits where it's like, okay, well, what's the perspective that we're taking? So really kind of cognitive theory, or like constructivist theory, which says that our appraisals are really the ways in which we make reality of the world around us. And so if we can shift the appraisal, well, then the world is going to look somewhat different to us. So that's sort of the theories that have inspired me there. And then I think with exposure therapy, I think the sort of idea that sometimes we have repeated experiences that shape us, and they shape the way that we respond emotionally. They shape the way in which our bodies respond. I think the book, The Body Keeps a Score, talks a lot about this, about how our body, we may not really recognize it or consider it, and maybe sort of stay up here in the brain region, but our body has a way of um, remembering experiences and remembering situations and responding to things, sometimes more quickly than we can recognize the thought coming up. And so I think from the exposure perspective, recognizing that our bodies tend to tell us a lot, and we often spend a lot of time ignoring it, or it can be hard to know exactly how to interpret what our bodies is saying. The body might be telling us this is dangerous, because it's somehow associated a situation with it being dangerous, when in fact the situation might be safe. So that like idea that repeated experiences may shape the way in which we physically feel and what we tend to do, also just felt sort of intuitive for me, and sort of shaped the way um, in which I approach exposure. And the idea of I've had lots of situations or experiences where I may have not been keen to do something or not been excited to do something. And then after doing it lots of times, I found, oh, this isn't so bad. From officiating my first wedding to now having done 5, it's not quite so bad anymore. But also things like leading groups. I wouldn't say I was always the most natural um, public speaker, but if you do 6 groups a week for 2 years, or longer than that, all of a sudden there's not as much anxiety there. You feel a bit more comfortable, and I begin viewing myself in a different way than maybe I had prior. That's really what exposure therapy is about. So, yeah.
Wonderful explanation, and we're really lucky to have you at the collective. So I just want to thank you for taking this time to talk to us about how you conceptualize and treat trauma here.
Thank you.